As you pull together the final touches of your holiday gatherings, you're probably hoping everyone stays healthy. It's been a rough flu season already, and it is not looking like it's going to improve. As News 10 NBC investigative reporter Jennifer Lukey shows us, the number of confirmed cases of flu A keeps soaring.
More than 200 people across our region are hospitalized with the flu right now. Thousands more are dealing with it at home. And after this week of family gatherings, doctors are worried what the first few weeks of January could bring.
Dr. Joseph Bilecki is a primary care physician locally, and his office has been quite busy.
The most common virus I'm seeing right now is definitely influenza A. We're seeing lots of cases run through, especially in the families that are in our office.
Confirmed cases of the flu are surging across the region. It's most widespread in Monroe County. But in Ontario County, the DMV was actually closed on Monday because too many employees called in sick.
The coughing, the sneezing, the upset stomachs, decided that it was not a good fit and didn't want, if the current employees have something, we don't want to give it to our public and spread it. So that was the reason for closing.
Most confirmed cases locally, statewide, and across the country are flu A.
Fevers, body aches, nasal congestion, upper respiratory symptoms like cough and sore throat. And they typically come on very quickly. So you're going to know, like, bam, within a couple hours, man, I do not feel well.
I think a lot of people say, gee, I don't feel good, and I don't know whether I got the flu, whether I've got COVID, whether it's just a bad cold. How do I determine what I've got and if that matters in the big scheme of things?
I typically will test people for major respiratory viruses that we can do something about. So I do flu, COVID, and RSV for a lot of my patients.
Is it one test, or do you need a separate test for each thing?
Thankfully, it's just one swab.
According to CDC data, fewer people have gotten the flu vaccine this year compared to last, and it's not as effective against the flu. But Dr. Bilecki says it still offers some protection against severe illness.
It's still about 40 to 50% effective at reducing hospitalization rates and still effective at reducing those symptoms that you have from flu. So for most people, the benefit way outweighs the risk.
Right now, it's mostly older adults and children who are hospitalized with the flu. But if you're dealing with it at home and you're not getting better after a few days, you should keep in close contact with your doctor. In Rochester, Jennifer Lukey, News 10 NBC.